Different kinetics of perioperative CRP after hip arthroplasty for elderly femoral neck fracture with elevated preoperative CRP. Via BioMed Research International. This study aimed to determine the kinetics of 4 inflammatory markers and to identify the variables that affect the natural kinetics of inflammatory markers in aged patients having hip fractures with and without elevated preoperative CRP. 240 elderly patients who have been operated on for femoral neck fracture with no infectious complications were divided into 2 groups on elevated preoperative CRP level, 10 mg/L. The temporal values of 4 inflammatory markers of WBC, neutrophil count, %, ESR, and CRP were assessed 8 times every other day until the 14th postoperative day. At 48 to 60 postoperatively, mean CRP was markedly higher in patients with preoperatively elevated CRP than in those with nonelevated CRP, and, however, the abrupt elevation of CRP in the elevated group was conversely decreased on the 4th-5th postoperative day, demonstrating similar kinetic curves with no significant differences between both groups. For WBC, %, and ESR, both groups showed similar patterns of temporal values 14 days after surgery regardless of preoperative CRP level. Our findings could be used as guidelines for patient discharge and during the follow-up period after surgery. Add tags, currently, Bioengineering, Research, Medicine by Alexandros G. Sfakianakis,